Hello, I'm Mary Sasresta. My student ID is U3221907 and this is my student ID. Today I'm filming my reflection video presentation using Barton's reflective model of what, so what, and now what by describing an event, what actions did I intervene, and how am I going to use that information for future practice. I'm reflecting on my work that I presented for Part A and Part B, which I did previously. The given case study was about John Samsil, who is 48 years old gentleman who was transported to hospital in emergency department following fall. He had standing height fall where John's head struck the concrete and John was drowsy and confused after the fall. After a number of diagnostic tests, it concluded that John was suffered a small subdural hematoma, a fracture of the right radius, superficial abrasion and bruising, and a fracture. John was given appropriate analgesia and a back slab applied to his upper arm. When attending John's call bell, on entering the room, John was sitting on a chair beside his bed and was rubbing the left side of his chest. He was diaphoretic and states, "I can't catch my breath," and was grimacing in pain. For this case study, I will start by talking about my strength, where I felt like I did okay. I was confident, professional, my voice was clear, and my intervention were within the nursing scope of practice. Developing trust is very important to get appropriate health information from the patient. My verbal communication helped me in seeking actual health issue that my patient was facing. I asked questions about his condition and how was he feeling, so that could correlate my nursing assessment as per patient's condition for effective and quality nursing care. I did A to G assessment and focused respiratory, neurological, and pain assessment. I did handover of my patient to other staff with thorough information of patient's condition and what intervention did I implement to help patient using handover tool. I did not use any jargon terminology that is hard for my patient to understand during patient's education. I use simple terminology to enhance my patient's knowledge about his medication for nausea. In so what, furthermore, I learned that most challenging part was collecting information which was precise and appropriate. After collecting the information, I had to critically think how to plan and implement nursing care for best possible health outcome of my patient. After reviewing the previous presentation, there are some aspects that I think I could have done much better. I had a poor time management skill during my presentation. I did manage to upload my video within given time frame. However, I should have prepared and practiced more to avoid that panicking situation that I had to go through during my assessment. During my ISBAR handover, I mentioned about pain assessment that I performed, but it would have been more clear if I had mentioned the pain score after giving analgesia as outcome. This way, it would help other health professionals to determine the efficacy of medication. In addition, any chest pain should be treated as cardiac issue. So I should have talked about doing ECG and reviewing by MO rather than only talking about advocating for chest x-ray. Besides, I talk about referring John to tissue viable nurse, where I think now that it would have been better if I escalate this superficial abrasion to team leader for review and then go from there. In regards to my patient's education, it was thorough, clear, and simple. But if I think myself in patient situation now, my communication pace was a bit fast for my patients to understand because he was in uncomfortable condition because of pain and nausea. So it might have been difficult for my patient to actually grasp and understand every situation. Information. Now what? From this assessment, I learned that it is very important to obtain patient's information with clear and effective communication and active listening to determine nursing care and plan. After analyzing these drawbacks that I have reflected from my video response, I will put more effort on time management, learning, and enhancing my professional communication and critical thinking skill. I will practice more case studies to develop and enhance my critical thinking skill, which I think I can improve with my ongoing education at University of Canberra, clinical placements and assessments. Moreover, as per Muse chart, pain score went down from 7 out of 10 to 4 out of 10 after analgesia, which determines positive patient's outcome. So I have learned from this experience that it is more clear if I mention about outcome during handover than just talking about intervention to enhance quality of nursing care provided. Also, I provide patient education about medication when I provide patient education about any medication or procedure, I'll make sure that my patient is in good condition to understand and grasp the information, and I will always double check if patient understood the information provided and answer any queries from patient side. I will always do what's best for the patient and seek advice from senior nurse or team leader in case of complications or referrals. Once I get feedback from assessor and with my own experience during OSCA, I will implement my feedback and experience for further positive changes and hone my nursing skill in future. This was an enlightening experience for me, and I really feel like a nurse for a moment. Thank you.